Hello everyone, welcome to Jessie's MedBio. In today's section, I am going to discuss about the remaining topics from preventive pediatrics. So, I am going to discuss about immunization, cold chain, under 5 clinic or well baby clinic, and prevention of accidents. So, first one is the immunization. Immunization is the process of protecting a person from infectious diseases by giving vaccines that stimulate the body's immune system to produce antibodies. So, immunization is a process. Under this process, we are giving the vaccination to the people. So, we can able to protect them from the infectious diseases, and also we can able to prevent the occurrence of the diseases. And by giving the vaccination, the body's immune system will get stimulated to produce the antibodies. So, immunity means it is the ability of the body to resist infection and disease. Here the immunity is classified into two. First one is innate or natural immunity. Second one is acquired immunity. The main difference between the innate and acquired immunity is innate immunity means it is present from the birth itself. But the acquired immunity means it develops only after the birth. And also the innate immunity is a genetically inherited, which means it is transmitted from the mother or parents to the children, and it gives a non-specific protection. Acquired immunity means it gives a specific protection, and again acquired immunity is classified into two, that is active immunity and passive immunity. Active immunity means body produces its own antibodies, but passive immunity means ready-made antibodies are given. And the active immunity and passive immunity is again divided into two. Under the active immunity, natural and artificial active is coming. So natural active means immunity developed after natural infection, which means after getting recovery from the infectious diseases like chickenpox or measles and all, we will get the natural immunity. But artificial active immunity means immunity developed after vaccination, which means after getting vaccinated for BCG or DPT or hepatitis B. After getting the vaccination only, we are getting the immunity, that is artificial active. Natural means we are getting the immunity from a natural infection. Artificial means we are getting the immunity after the vaccination. Then passive immunity is also divided into two, that is natural passive and artificial passive. Natural passive means antibodies received from the mother, which means the IgG, the immunoglobulins like IgG, which is received by the baby from the mother through the placenta. Also the IgA, which is received by the baby from the mother through the breast milk, that is natural passive. Then artificial passive means antibodies given by injection, by giving certain type of injections like immunoglobulins for tetanus, rabies and hepatitis B and all, we are getting the immunity. So natural passive means we are getting from the mother. Artificial passive means the antibodies or the immunity we are getting by the injection. So active immunity will develop very slowly. It is long lasting. Memory cells are formed. It gives a long-term protection. But the passive immunity, it will act immediately. It has very short duration. No memory cells are formed. It provides a short-term protection. That is about the classification of immunity. So the next topic is cold chain. Cold chain means it is a type of system which is mainly used to store and transport the vaccines. The cold chain will help to transport the vaccines from the manufacturing site to the vaccination site in a correct temperature. Mainly they are transferring the vaccines at a temperature of 2 degrees Celsius to 8 degrees Celsius. So the cold chain can able to ensure that the vaccines remain safe, effective and potent until they are given. The recommended temperature I already said that it is from 2 degrees Celsius to 8 degrees Celsius. Then most heat sensitive vaccine, OPV or oral polio vaccine is the most heat sensitive vaccine. It is stored at minus 20 degrees Celsius for long term storage. So it is a one MCQ question, most heat sensitive vaccine, that is oral polio vaccine, which is stored at minus 20 degree Celsius. That is about the cold chain. Then we are moving on to the another topic, that is under 5 clinic or well baby clinic. It is also an important essay type question for the exam. So under 5 clinic means an under 5 clinic or well baby clinic is a health facility that provides comprehensive, preventive, promotive, curative and referral services for children from birth to 5 years to ensure healthy growth and development. In under 5 clinic, they are mainly focusing on the children from the age group of birth to 5 years. For those children, they are providing proper preventive, promotive, curative and referral services in a health facility to promote proper growth and development of the children. That is about under 5 clinic. It is a type of health facility. It is a symbol of under 5 clinic, which is represented as a triangle, in which they are mentioning about the health education, care in illness, family planning, growth monitoring and preventive care. So I am going to explain each one. So first one is care in illness. The symbol represents care and treatment of sick children. Care in illness means they are providing proper care and treatment for the children those who are sick. Care in illness comprises of diagnosis and treatment of acute illness. They are providing proper diagnosis and treatment facility for the acute illness and also for the chronic illness, which includes the physical, mental, congenital abnormalities, then growth and developmental disorders, and also providing X-ray and laboratory services along with the referral services. These are the activities or the care which is provided for the children who are sick. That is about care in illness. So the second one is preventive care. Under the preventive care, the first one is immunization, which means they are providing the proper vaccination according to the age of the children. Then nutritional surveillance, they are conducting the nutritional survey to identify the nutritional status. Under this, they are providing the nutrition supplements also, like IFA tablets or vitamin B supplements and all they are providing. Then health checkup, they are conducting the regular health checkup, so healthcare members can able to detect the disease conditions early and able to give the treatment appropriately. So next one is oral rehydration, which means they are providing ORS to the children, those who are suffering with diarrhea. To prevent the occurrence of the dehydration, they are providing this. That is about the oral rehydration. The next one is growth monitoring. This is the biggest activity of under 5 clinics to weigh the children periodically. So it is very essential to weigh the children at a regular interval of period. So we can able to monitor their growth and development. So during the first year, every month we have to weigh the children. Then during the second year, every 2 months we have to do. And from second year to the age of 5 to 6 years, every 3 months we have to do this. And we have to plot the weight on the growth chart according to their age. So we can able to detect their growth and also we can able to detect the growth failure. So fourth one is family planning. Family planning in the center of the symbol is a triangular area which is red in color. It indicates family planning, which is the center of concern for health and well-being of the child. The mother is given family planning advices in the clinic, which means in previous slide I show one triangle. In that triangle, the family planning is represented at the center area and also which is in red color, and it indicating that family planning is the center of concern of health and well-being of the child. So when the mother is coming to the clinic, the healthcare members are providing the family planning advices. about the family planning methods, and if the family planning is not happening properly, it will cause bad effect to the health of the mother and the baby, and it also affect the economic status. That is about the family planning. So next one is the health education. It represents the health teaching that mother receives when she takes her baby to the clinic. The mother receives teaching related to nutrition, immunization, family planning, and care of the child in illness. Health education means it is a teaching and it is given to the mother when he coming to the hospital. What all other teaching we are providing means about the nutrition and about the vaccination, family planning, and also about the care of the child in illness. These are about the under 5 clinic or well baby clinic. So the next and last topic is prevention of accidents. An accident is an unplanned, unexpected event that results in injury, disability, or death. Most childhood accidents are preventable with proper supervision and safety measures. So we all know that accident is unplanned and unexpected event. We are not planning, right? It is occurring unexpectedly into our life, and it can cause injury, disability, and even death also. So, but most of the childhood accidents can able to prevent by giving proper supervision and by maintaining proper safety measures. So the accident can be classified into two according to place and according to the severity. According to place, again classified into two, that is home accident and outdoor accident. Home accident means the accident which is occurring inside the house. Outdoor accident means the accidents which is occurring on the roads or playgrounds or in the school or other outdoor places. Then according to the severity also it is classified into two, minor accident and major accident. Minor accident includes small cuts or bruise formation or minor burns and sprains. Major accident includes fracture, severe burns or poisoning, drowning or head injuries. So first one is age. The children between the age group of 2 to 10 years are more prone to get the accident. Then sex. Boys are more prone to get the accidents because of their risk-taking behavior. Then personality. The children who are very active and curious and adventurous are at the higher risk. Then, so the third one is birth order. Elder and younger children may be at high risk due to less supervision. Which means due to the less supervision or due to the less guidance and all, the elder children may be at the chance of getting the accident more. Then time. Mostly the accidents are occurring in the afternoon time because most of the parents are taking rest during that time. At that time, there will be less supervision. Because of that, more accidents can occur in the afternoon. Then weather. More common during the rainy season. These are the factors which is affecting the accident. Then how we can able to prevent the accident? First one is the home safety. We should keep the medicines and chemicals locked or away from the children. Then we have to store or keep the sharp objects away from the child. Then we should cover all the electrical sockets. Then we have to keep the hot liquids away from children. Then we have to install the window guards and stair gates. Then next one is poison prevention, which means we should label all the medicines and the chemicals, and also we have to keep the poison medicines or substances in locked cupboards, and we should not store the chemicals or the medicines in the drinking bottles. The next one is the community measures. Under the community measures, we should give proper health education for the parents and provide the safe playgrounds, and regular supervision should be there. Then public awareness programs we have to give about the accident prevention. The next one is the road safety. We have to teach the children about the traffic rules. and also we should use the child restraints and the seat belts. And while crossing the road, we should hold the child's hand and do not allow the children to play on roads. Then burn prevention. We have to keep the matches and lighters away from the child, and we have to turn pod handles inward direction. Then keep children away from the stove and the heaters. Then next one is the drowning prevention. We should not leave the children alone to the water or near to the water. Then we have to fence the wells, ponds and swimming pools. So this all about today's class. So today we discussed about the immunization, classification of immunity, cold chain, under 5 clinic or well baby clinic, and last one is the prevention of accidents.